Curexo Technology Corporation brings the future of robotic surgery to life with the revolutionary ROBODOC surgical system. ROBODOC means unparalleled precision at a level that completely redefines precision for a new level of patient care.
I'm a tennis player. I just couldn't move around as I like to.
What does the future look like?
I can do just about everything. Everything. I can't run. I haven't tried to run yet, maybe never will, but I'm ready. I'm ready to try.
The ROBODOC system consists of two components. Preoperative planning is performed on the OrthoDoc preoperative planning workstation, while surgical execution is carried out using the ROBODOC electromechanical arm. A typical ROBODOC procedure consists of the following steps. The first step involves a CT scan of the patient's operative hip joint. The next step involves planning with the OrthoDoc preoperative planning workstation. The CT data is converted to a three-dimensional surface model of the femur. The surgeon selects an appropriate implant and places it along the axes of the bone with the help of anatomical landmarks. The surgeon can manipulate the implant to optimize placement and orientation.
You can plan it better because you're looking at a CT scan, but more importantly, you can execute the plan. Because we have to be sub-millimeter, we have to be very accurate. Each patient's a little different. And so we have to be able to address things like offset and leg length. And so by preoperatively planning this and being able to execute what you plan, you can now address those things, and those are very important in terms of how the hip functions.
The surgeon controls ROBODOC in the OR via a pendant and monitor, which guides him through the procedure. At any point, the surgeon may stop ROBODOC to evaluate a cut or retract soft tissue prior to proceeding with the surgery. Prior to every ROBODOC use, a number of diagnostic procedures are run to ensure that the arm is functioning accurately. Surgical exposure of the joint during a ROBODOC surgery is the same as a conventional procedure. The operative leg is stabilized. One of the safety features built into ROBODOC is the bone motion monitoring system, which halts the robot if any bone motion occurs. The surgeon can then restart the procedure using the recovery system without any loss of accuracy. Bone registration is simple, using a digitizer to collect points. Unlike navigation, ROBODOC does not require the surgeon to find anatomical landmarks intraoperatively. Instead, the ROBODOC registration method is based on a simpler, more accurate point-to-surface technique. After registration, ROBODOC can begin milling the bone. The surgeon is instructed to guide the cutter to the top of the bone and ensure that all soft tissue has been properly retracted. At all times during cutting, the surgeon can directly view the bone as it is being cut and the OR monitor, which also shows the cutting progress. Once ROBODOC has finished preparing the bone, the surgeon proceeds with implant fitting and insertion in the same manner as a manual joint arthroplasty. ROBODOC excels in terms of both precision and accuracy when it comes to correctly placing and orienting the implant. The results from ROBODOC cases speak for themselves.
In college, I broke the pelvis playing soccer and had it plated and screwed back together. And over the years, things just got to be where, as I was being more active, the recovery time was longer and longer and just hurt more and more, and I got to the point I couldn't do as much with my kids.
Tell us about your experience with Dr. Barger.
We reviewed x-rays, he showed me the components that would be used. We talked through how the robot was used in an interface with the CT scan results, walked me through how my leg would be positioned and the screws that would be used to hold things in place.
I've had 2 ROBODOC surgeries actually. 15 years ago, in the research protocol, I had my left hip replaced, and it's 4 square and solid. But over time, the other leg started to develop trouble with arthritis, and that meant less and less active and a slower and slower pace.
What does your future look like?
I see that this is allowing me to really get back to the life that I've always enjoyed. And I'm just absolutely grateful for ROBODOC making it easy and possible.
ROBODOC is a proven clinical system. The surgeon can have confidence that it will precisely execute his plan in the clinical setting. Patients and surgeons are attracted to new technologies with proven benefits. ROBODOC's exclusive open architecture platform enables the use of implants from virtually any manufacturer. ROBODOC reduces the need for additional surgical instruments and equipment. The advantages of the ROBODOC surgical system include high precision smart tool technology, elimination of less accurate templates and jig-based technology, precise pre-surgical plan execution every time, sub-millimeter dimensional accuracy, precision milling for optimal alignment, 95% bone to implant contact, consistent, reproducible outcomes, non-optical technology.
You can plan it better because you're looking at a CT scan, but more importantly, you can execute the plan. Because we have to be sub-millimeter, we have to be very accurate.
The tandem technologies of OrthoDoc and ROBODOC have been used in over 24,000 successful total joint replacements worldwide. Our current system yields significant advantages for the patient, the physician, and the hospital. Precision and reproducibility are a rare combination, and when harnessed together, create an exceptional tool. To learn more about how this technology can benefit your facility, contact your local sales representative or visit our website at www.robodoc.com. ROBODOC, the first, the foremost, the future.